Registered nurse Renee Elmer.
I am a registered nurse, and I work with my husband, who is a general surgeon, and we work in Dunn.
Probably a lot of those.
And we are very concerned about the health care, as are many nurses and doctors. Are there any nurses and doctors or any health care professionals? Wonderful. All right. You know, we are in defense right now for our country. We are in defense right now for the best health care system in the entire world.
Amen, sister.
You know, there's a lot of misconceptions out there. Our leaders are stating things like doctors and nurses are overwhelmingly in support of this Obama health care plan. That is just flat out, and you know it. Any of the health care professionals, what I would like to pose to you is talk to your doctors. Talk to the nurses that are helping take care of you and your family members. You will understand their point. They will talk about their concerns. You know, when you go to the doctor's office, the doctor or the nurse isn't necessarily going to ask you about it because you're there for your health care. And they're going to treat you no matter what it is that you're thinking. You may be on board with the Obama health care plan and you're still going to get that health care. But if you bring up the question to them, you will see the concerns that they have. Government wants to take over your lives from preconception to death, and there's no doubt about it. I was watching the news this morning, and one of the advisors to our president is Rahm Emanuel's brother, who happens to be a doctor. Now, he is not a practicing physician, but he has expressed to the president that he has issues with the Hippocratic oath that all doctors take. And I am very worried about that because the Hippocratic oath basically states do no harm and protect life from conception to death. Now that's obviously going to get in the way now, isn't it? So that's right. But that's basically my message today is that doctors and nurses are really very worried about this situation. And if my husband were here today, now he was with us yesterday for part of the day, but he did have to go back to work to take care of patients. Doctors can't necessarily come out like this because they're busy saving lives and they're busy taking care of people. But if my husband were here right now, what he would tell you is that he does not want a government bureaucrat in the examination room standing in between you and him.
That's right.